So welcome to the final presentations. This is track J presentation. So if you're from a different track, I would request that you go to the organizer announcements channel and find the track that you're supposed to be in. We're gonna start it off by just previewing what you guys were working on. It's been a long weekend where you guys have been spending sleepless nights trying to come up with a problem statement, a solution that could really have an impact on the African population in terms of educating them about this virus and what they need to do. So we wanted to share some judging criteria with you on what to expect. And this is information that you should have received on your participant guide. So just wanted to just preview this again for you guys before we start presentations. So it's all about impact, innovation, implementation, and presentation. And this is information that you should have at least gotten, if not from the resources, from the practice pitches and the conversations with your mentors. So before I move to judging logistics, I'll have each of our judges introduce themselves. Keep it to 1 minute so that our participants and team here can know who's going to be judging them today.
You want us to start?
Yes.
Okay. Hi, I'm Bill Carter. I'm an associate professor of practice. I'm also a consultant to MIT, and I'm also an award-winning filmmaker, writer. I work a lot on humanitarian issues around the world. And this got dreamed up with a couple people in global programs at MIT and myself, and then this team that you've been dealing with is unbelievable. Let's put it all together. So it's very exciting to be here, and we were very excited to hear your pitches.
Awesome.
Okay. I'm Olusegun Onigmide. I'm the director for budgets, also co-founder of an AI company called Queti. I am also on the board of One Africa. So I'm glad to be I'm happy to be very here, and to listen to your great pitches. And I know it will be a fun afternoon, evening, or morning, whatever you have. Thank you.
Hi, everyone. This is Ali Diallo. I'm a White House Presidential Innovation Fellow and the Africa Advisor to the Prince of Jordan. And I'm also the CEO and founder of a company called United, which is it's an impact investment group focused on Africa and the US in the form of building bridges between the two continents. And I'm also the former MIT Legatum Center Program Manager for global initiatives. So happy to be here.
Thank you. All right. So I guess we'll kick it off. So in terms of logistics, this is how this will happen. The presentations will be recorded. One member of your team will present. However, you can have other mentors help with Q&A. So that's between you guys' team to decide who does that. You will have 3 minutes to present, 2 minutes for Q&A. The order you present in is random, and we will tell you that you're up next, so you have 5 minutes to prepare. If you will be presenting for your team, please raise your hand, and that can be found on the participant tab on the bottom of your screen. And the host, me or Elizabeth, will tell you when to unmute yourself. When it's your turn to present, you will unmute, turn on your video if you can, and I'll flip the slides for you. I will give you 1 minute warning by I'll hold my camera up. So I'll turn on my camera on my video, so make sure you can see me on your screen to give you that 1 minute warning. And yeah, the judges will pick 3 teams for this track. So raise your hand, wait for the host to call you, present for 3 minutes, just one person, and Q&A for 2 minutes. Awesome. All right, so let me just make sure I have my timer here ready. And for the first team, if you could raise your hand if you're a presenter, we have Know Your Myth, and the next team will be Mythbusters. So Know Your Myth if you're on, raise your hand and we'll give you, you can unmute yourself and start. And for the people who I'm not calling on, like the teams that have not been called on, please do not raise your hand because then I don't know who's supposed to be unmuted.
Yes, please, if you're not presenting right now, please lower your hand.
Yeah.
So
If
I
you're
think the
not-
next person, I think it should be Kanita that's presenting for Know Your Myth.
Yes. So if you know your myth, please raise your hand.
Yeah, I'm Kanita. My hand is raised.
Awesome. Great. So Kanita, I'll flip to the first slide and start the timer. Just a minute. Are you ready?
Yep, I'm ready.
All right, go.
We are the Know Your Myth Network. Next. The problem we're trying to address is that we know that misinformation is a major barrier to preventing infections and flattening the curve, and it's something that needs to be urgently addressed. Next. Our mission is to establish a community engagement network devoted to saving lives by empowering people to make informed decisions in an interactive and engaging way. Next. We talk to people throughout 3 different countries in sub-Saharan Africa and to get a sense of what types of misinformation is being proliferated. And I want to introduce you to 3 of them. Meet David from Malawi. He's a taxi driver who uses a smartphone. Grace is from Uganda. She lives in a semi-urban environment. She has a basic phone and listens to the radio. Then we have Mama Afua, who's from a rural area in Ghana. She doesn't have internet access or electronics. And so we wanted to come up with a solution that would help to reach each one of these individuals. We know that although they're different, they're share the commonality of economic hardship. Next. We know that COVID-19 is not a game, but we believe that learning about it can be. Next. So our solution is to develop an interactive gaming platform with different options for every level of tech capability. It'll be a fun way to debunk myths and provide accurate, verifiable information from sources like the WHO and the respective ministries of health. Our users will be able to interact with our games based on their environment. Next. This is a snapshot of what our application would look like. If you're using the platform or the game through an app, you'll be able to have a set of true and false questions that will be a fun way to interact with, to debunk the myths. And you'll also be put on a leaderboard that you could help have the opportunity to possibly get certain rewards. Next. If you're like David and you have a smartphone, you'll be able to interact with our platform through a traditional mobile app. Next. If you're like Grace and you live in a semi-urban environment and you only have a basic cell phone, you'll be able to interact with our platform through a radio program known as the Know Your Myth Challenge, where radio announcers will be equipped with our information, facts, and myth debunking information and have an entertaining, interactive radio show program for people like Grace. Next. If you're like Mama Afua, we've also thought about how to reach you. We will use existing strategies that are already being in place in some of these areas, and we'll use community champions. These community champions will be equipped with verifiable facts and information and having a safe way to interact with people like Mama Afua. Next. This is our competitive landscape. Our network is fun, it's sustainable and scalable. We believe that it has high scalability and high accessibility. Next. Misinformation will outlast COVID. Next. These are some of our partners. And next, this is our team spanning 4 continents, 6 countries with one mission to defeat misinformation around COVID and help save lives. Thank you.
Awesome. Thank you so much, Kanita. I'm going to open it up to judges for 2 minutes.
Shoot, I can't find anything. Hold on.
While the judges are thinking
Hi,
about...
Camila.
Yeah, Ellie?
Hey, Mercy. Hey, sorry, I was on mute and I've been speaking for 30 seconds.
Yeah.
I have a bunch of questions. So one of them is tied to the prices. Have you guys thought about tying specific cash prices or incentive to create some more engagement?
Sure. I'm going to defer to my team members and let them answer. Amos, can you answer?
Yes, I can. We've thought about that already. Some of the prices we are looking at from the telecoms are data bundles and also airtime, but also the cash prices on mobile money, MTN mobile money, Airtel money, and that kind of stuff.
Okay. And what about the potential literacy rate issue? How do you get around that for those that cannot necessarily follow a game using a smartphone? How do you address that?
So what we discussed in a group based on what is happening in Africa, the community champions, these are the lay provider people in every village that have megaphones, speak the local language, go where the people are, in markets, in the community, and they are essential workers because they keep delivering health information even during lockdowns to support saving lives. So those are our key people, local language, where people are in their space.
And also the radio.
And also the radio platform that does the local language, the radio presenters.
Okay.
All right. Thank you. Thank you, team, and thank you, judges. We're going to move on to Mythbusters. The next team is COVID-19 Myth Tracker. So if the presenter could raise their hand so that we can know who to call on for the next presentation. But Mythbusters, I think, Rainel, you're presenting.
Mm-hmm.
Yes,
It should
hi.
be Manasai.
Awesome. All right, so I'm gonna flip to the first slide and then we're gonna get your time started. Ready?
Yep.
All right.
A solution to overcoming COVID-19 in Africa focuses on busting myths by educating specific target groups in order to flatten the curve in Ghana, Africa. Next, please. Meet Abigail. She's a single mother of 3, originally from a rural town called Bibani, and works as a Kayayo in Accra. She hears a radio broadcast by the president of a herbal medical association that boiling neem leaves in water and inhaling the steam or taking a bath with the water can cure symptoms of COVID-19. She believes this is true and therefore does not practice social distancing and regular hand washing. 2 weeks later, Abigail, her children, and a few neighbors contract the virus. This wouldn't be the case if Abigail had access to the right information. Next, please. Our focus is to educate daily wage and contract workers living in rural areas and urban slums who don't have access to resources like the internet to fact check their information. By having the right information, safe working conditions can be created so that they can continue working while practicing social distancing and good hygiene measures during COVID-19, therefore reducing COVID-19 related unemployment and flattening the curve at the same time. Next, please. In order to do this, we would partner up and gather information from local organizations and medical research institutions in the area, and use posters and popular local radio stations to broadcast correct information using our 2-tier educational model. Next, please. Additionally, in order to reach community members who don't have access to phones, the internet, or radio services, we have developed a community-based announcement system. This is a radio station on wheels that could include educated community members doing the rounds on the streets, giving out updated information that people can access right at their doorstep while practicing social distancing measures. Next, please. We would also create visual posters tailored to specific populations about how to continue their daily jobs without putting themselves or others at risk. Next, please. While simultaneously reaching community members who speak different languages and who cannot access the internet. Next, please. We will also pictorially depict local celebrities practicing safe prevention measures to encourage community members to follow suit. Next, please. Our proposed timeline is as quick as 2 weeks, with spending the first week gathering artists, cho-cho drivers, volunteers, and partner organizations on board, then using the second week to gather data and educate community members. Next, please. If implemented, our plan could reach out to the 7.5 million people across Africa, some of whom are just like Abigail. Next, please. We plan to upscale our project to reach more rural areas across the country and seek your help to collaborate with potential partners on the next slide, please, to improve the operational efficacy of our project. I would like to acknowledge all my team members. Next slide, please. And our wonderful mentors and MIT for giving us this amazing opportunity. Thank you.
Awesome, right on time. So I'm gonna flip to the judges for any feedback or questions that they may have.
Yeah.
I'd like to ask, if this is this an idea where you think it could be transferable to the entire continent?
Sorry, could you please repeat that?
Is this an idea that if it gets scaled up, you think it could be transferred, throughout the entire continent of Africa?
Thank you, sir.
Yeah,
I'm
I
Sachin, a
think
part of the team. I'll take that question. Yes, so based on our timelines, this plan can be scaled up to about 7.5 million given a 2-month timeline. But with more support and resources, it can definitely be scaled up to the entire continent.
Okay.
Hi guys, this is Ali. I just have a quick question. So could you dive a little bit more about on the actual solution that you're providing? It seems to me that it's a broadcast focused solution, right? Especially with the radio on wheel concept. How do you ensure that there is some sort of feedback loop mechanism so that you also gather and collect data from users and create that two-way communication? Can you explain that briefly?
so. Firstly, we would partner with organizations to educate community members, and then those educated community members could be in vehicles broadcasting the information, and then to complete that loop, we could take surveys from local people and then see whether it works or what we can do to improve the efficiency.
Okay, thank you.
Awesome. So we're gonna transfer to COVID-19 myth tracker, and coming up next is misinformation. So if the myth tracker team can raise their hand, I see Greg on here. The next team, misinformation, be ready. So Greg, are you ready?
Yes, can you hear me well?
I can. Awesome. So whenever I flip to the next slide, you can get started.
Okay. Greetings. Today we'll be talking to you about mangoes and pawpaw leaves. Next slide, please. If you want to combat misinformation, then, as Sun Tzu says, know your enemy. What exactly are we combating? Others are developing amazing solutions for collecting or disseminating public information, but what kind of information should we provide? And to whom? COVID-19 misinformation is not monolithic. We want to understand what people are thinking at a very granular level so that we can help relevant policymakers come up with local solutions for local problems. Next slide, please. For example, there has been a lot of talk recently about a COVID-19 vaccine, but there are lots of varying ideas on this matter. Some people in Africa believe vaccines are an evil plot, while others believe mangoes or pawpaw leaves are the cure. As such, when a vaccine is eventually rolled out, its success will depend on local conditions. Does the particular neighborhood even trust the government's vaccine? How will this affect health policy? Next slide, please. By using social media analytics, we can create a perceptual map and identify influencers in particular communities to see what misinformation is being spread, where, and by whom. These insights can be utilized to inform targeted policy and evaluate the role of public perception in health outcomes of different countries. Next slide, please. Similar work is already being carried out in other countries, but such technology hasn't been applied to Africa yet and will allow us to track changing perceptions about the pandemic in real time. For example, in these mock-up perceptual maps, each color represents a community cluster who may be sharing and talking about different myths. For example, among those still spreading myths about pawpaw leaves, which specific neighborhoods are they located in? We could then reach out to the imam of those particular communities. This type of hyper-targeted intervention would be far more powerful than a uniform mass media campaign. Next slide, please. Our solution is relevant to multiple customers, including policymakers, grassroots community leaders, and media organizations, all who want better insights on how to best create the right messaging to fit the needs of particular communities. Next slide, please. Combating COVID-19 misinformation is an urgent matter, and our solution can be executed at speed. All the pieces to execute our solution already exist, we just need to put them together. We propose to choose a pilot market such as Egypt, with high penetration rate of internet and social media, work with partners in the US and Africa with existing capabilities to convert data into useful insight, and deliver these targeted insights to help inform decisions of governments, NGOs, local leaders, and so forth. If this is a war against misinformation, Myth Tracker will help identify the enemy and where to strike. Thank you very much.
Awesome, right on time. I'm gonna open it up to judges for questions.
Okay, I think I should start. Great presentation. My question is about the data you're trying to build, the purple leaves. I mean, the whole cloud of stuff you showed. Where is that coming from? I mean, are you working with like mobile operators? Are you working with technology companies to be able to have access to that level of data in terms of the spread of such misinformation? I like the influential part, but I just want more clarity about that.
Great question. Liz or Mohammed, would you like to jump in?
Yeah, I'm happy to jump in. So in the example that we were using, all of that social media data is pretty widely available through existing API endpoints.
Okay.
We would love to eventually, I think these same methods could also make use of other data if we can get access to it through cell phone carriers and so forth. If we get national buy-in, for example, from a country like Rwanda or Egypt, perhaps that could lead to more data. But like Liz said, we have access to data we need for what we've presented.
All right. Perfect.
Can I ask you a question really quick? Is what this weekend? What about this weekend helped you address this issue inside this hack, with working with your team?
For me, it was realizing that a lot of people are developing solutions that are great in terms of wanting to label information as accurate or inaccurate or distribute information better or so forth. But really, no, we think we're the team that provides the foundation to all of those solutions. More nuanced information about the spread of perceptions about COVID-19, which have effects on the effectiveness of health interventions and behavioral change communication, other public health messaging.
Thanks.
All right, awesome. So we're gonna move on to misinformation. Is misinformation here? The next theme is indigenizing COVID-19 awareness. If you're part of misinformation, please raise your hand and unmute yourself.
I think it should be Mabel who's presenting.
Yes. Mabel, are you here?
Yes.
Awesome. So I'm gonna move to the next slide and then you can get started, putting 3 minutes on the clock.
Okay.
All right. You can get started.
Okay. In this team, we are with Peter and Mabel. Peter is from Nigeria and from Zambia. So for us, we are combating misinformation through text messages, spreading factual information on COVID-19. The problem that we identified is misinformation, resistance to vaccination, and prevention controls, and mistrust. So for us, we are not going to kill everything that other providers are doing. We will continue supporting the lockdowns, the testing, symptomatic treatments, and stay home campaigns, mask up, but also we will continue with our model of texting messages and WhatsApp. It's a solution for us is raising awareness and also provision customer care, but also it's also to engage other stakeholders. The next, provision of feedback platforms and customers to air their views on COVID-19 misinformation. Next slide. Then ours is when we send these text messages to correct the misinformation, it will help eradicate falsehood and fake news that first spread on COVID-19 and in the way it spreads. It also gives us, next, it also gives us the exact information on the number of COVID cases, of the infection persons, mortality rate, and numbers of patients. The factual information in combating misinformation on COVID-19 is also spreading details information on location isolation centers and how to carry test COVID-19 for people having similar symptoms and those. Next.
1 minute.
Okay. We also promoting harnessing the potential of African Extensive Wireless Network. Next. Encourage people, inform and get information only from credible sources. Next. Our unique value is problem solving. Next. Platform network. Next. And quality control delivery. Next slide. Our concept is to text messages and WhatsApp messages. Next. We want to use patience, maturity, thinking about the customer's position. Next. Be helpful to customers and keep all our promises, and also use non-verbal communications. Next.
Seconds.
Ours is to send text messages to win the virus war, and then and impending social disruption, there is need to effective risk communication and community engagement. Next.
So we're gonna stop you right there, Mabel, because we're out of time. I'm gonna open it up to the judges, however, to ask any questions or provide any feedback they have. Thank you.
Thank you.
This is Ali. I'm just gonna start. So how do you plan on capturing the phone numbers to send the messages?
We plan to partner with service providers like Airtel, MTN, and other telecommunications providers for us to be availed with those telephone numbers.
Okay.
Can I ask you real quick, how is this different than what's already happening right now in various countries in Africa? Meaning,
Come again?
how is this solution different than maybe what's already happening? Are people using WhatsApp? Are people using SMS to spread this awareness already? Meaning, what's the innovation?
Okay. Yes, for us, the reason why we chose the texting messages and WhatsApp messages is because we have seen that the people are widely using these services, but at the same time, it is widely abused. And these are some of the channels that people are using to spread misinformation. And so we say that to counteract to that, we want to use the same platforms to which they are already used to communicate the factual, science-based, and research-proven information.
Mercy, can I ask you a question? This is a technical question. This is team J049.
Yes.
And what was the last team number?
Let me just scroll over.
37.
37.
Thank you. Yeah, thank you.
Thank you. Thank you, Elizabeth.
Not a problem.
Awesome. So we're going to transition to Team 10, Indigenizing COVID-19 Awareness. I'm seeing 3 hands here. If you're not part of that team, please put your hand down. And if you are part of the team, please unmute yourself. Make sure you can see my video because I'll be giving you time signals, like the 1-minute time signal. Is this Milias?
It's Miles.
Miles? Okay, awesome. The floor is yours. Once I flip to the next slide, you can get started.
Okay. Hi, we are Indigenizing COVID-19 Awareness, and my name is Miles Piri, and we are tackling the problem of grassroots lack of access to information in Nigeria. So today, 60% of Nigerians live below the poverty line with major disparities in the northern states. 12%, that is over 24 million people, belong to minority groups, and information is not translated in their languages. Most information is currently being shared through TVs. Next slide. Next, most information is being shared through TVs, and people need subscriptions to satellite TVs like DSTV, and there is a constant lack of power, so that means many people do not have access to information. And social media platforms such as Facebook have unverified information and only are available to less than half of the population with internet access. Next slide. This population needs accurate information on messages such as prevention methods, statistics, and facts to debunk myths so that they can make informed decisions about their well-being as the country is easing lockdown measures. So our solution is a two-part solution. The first one is phase one, using radios, because we know that radios have been used through and through to for many people to access information. So to ensure that the 24+ million people also get access to accurate information, we will use radios. And to do so, we use volunteers to translate information from reputable sources such as the World Health Organization into local languages, and then use existing radio shows to share information through edutainment, which is entertainment with educational aspects, such as music, skits, and stories to convey the messages. And using community radio programs, so there'll be people either driving a van or walking around the community and just playing these like music or skits and stories to the people in the community. Next slide. The second phase is collaboration. So we acknowledge that people in these communities trust and respect their local leaders, that is religious leaders, chiefs, elders. And so we will partner with those people to, continue mobilization. And it's important that people receive information from these entities so that, because of the already existing trust and respect they have for these people, and their local leaders can share messages of hope, statistics, and prevention. We also acknowledge that so many people are scared right now. And we will also approach the leaders through Facebook pages, because a lot of churches, a lot of like elders have Facebook pages, and we will just like call in or visit offices. And we will also use already existing translating platforms such as Translators Without Borders, and leverage their already existing
10 seconds.
Community of volunteers. Yeah, so our impact, we hope to have reliable and accurate information accessible to over 24 million people, to have information understood by more than 40% of illiterate population, and to reduce transmission by promoting prevention and flattening the curve. Thank you.
Awesome. Opening it up to judges for questions.
Hi, this is Ali. Is there any technology component to your solution?
Right now, no. We want to solely focus on the radio so that we can reach everybody. And because we know it's inexpensive, and so many people that do not have electricity can have solar powered radios as well.
Okay. Bill asked that question a couple of minutes ago, but how is your solution different from what's going on out there in terms of government trying to raise public awareness using radio, and telecom operators doing the same using their channels? What's unique about your solution that's different from them?
Ours is specifically targeting those languages that are not yet included in the translation of this information. So I know right now there's information in Igbo, in Hausa, and in Yoruba, but there is barely information in Bari or any other minority groups. So that is how we're differentiated from what's already going on. And we are going to be making sure that information is passed on in entertaining ways, because people want to move away from this fear and just listen to something and yet still be entertained.
Okay.
Awesome. If there's no other questions from the judges, I will move on to Team COVID Truth. Team COVID Truth, please raise your hand. I see there's 2 people who've raised their hand. So if you're not part of Team COVID Truth, please put your hand down so that we can know who is coming up next. All right, Charlene, you can unmute yourself and we can set you up in a minute. Hello?
Hello, can you move on to our slide?
Yes.
Yeah, just play this video. It's exactly 3 minutes.
All right. Let me see.
Good morning, everyone. We are Team COVID Truth.
A highly visible source says disinfectants will take out the virus in 1 minute. Another source says do not drink disinfectants. You hear both and they are opposed. What do you believe? The problem in Africa and our solution will be presented in the next slides. So Africa faces vulnerabilities to infectious diseases because of pre-existing conditions. So one of these conditions is low literacy levels, because Africa has some of the lowest literacy in the world. Accessibility is worsened because not all African languages are available to most technologies, and experts do not always communicate in ways that make it easy to translate in these languages. The messaging is also skewed by the fact that peripheral information, it does not square with central information of facts and figures because their goals are not aligned. The problem is made challenging because of false consensus. No one cares about the source of information provided many people believe it. People observe other people not complying and feel it is okay to not comply with the guidelines. And then there is sporadic collaboration among all these sources of information. The trust crisis worsens things because people suspect their government and suspect agencies that create the vaccines.
We propose to be the crowdsourcing forum with intelligent recommendation algorithms and African characteristics. Our forum outperforms other existing platforms with regard to the problems faced in Africa. This inclusive platform contains clinical workers, scientists, patients, etc. Each user has many associated attributes. We use the geography, clinical records, economic levels, and languages to construct a similarity network for the recommendation purpose. Then we can conduct semi-supervised learning to predict the expert scores, users, and the truthfulness of content simultaneously. This step guarantees a high signal-noise ratio. Finally, the forum can summarize information and transform into other media formats, such as radio and print newspaper. Let's have a look into our website. You can access it from any place by this address. On the homepage, you can see news from well-known media sources. If you click the forum button, it will navigate to a page that supports many languages. You can ask and answer questions in any language. You can even do a search. You can see the profile of other users and even look up a future event related to COVID-19.
All right.
This is what we did in this weekend. Thanks for your listening.
Awesome. So judges, I'm going to provide you with 2 minutes to ask any questions you might have.
One quick question. So in your solution slide, you mentioned a big data platform and some sort of access to medical records. How do you plan on accessing those records? And how do you plan on managing privacy rules?
Bill, as for the first question, that how to reach out to this patient, to this persons, our solution is build a inclusive platform ecosystem so that everybody are willing to share. So currently we are more focused on the technical parts. And as for the second concern about privacy, if you go to our website, you can see that we implemented the Google login API and Facebook login API, just like all the other websites. We just record your name and the profile photo. So there are no privacy concerns.
So this is an opt-in model, right?
Yeah, you can access it.
So one of the challenges that we've seen in Africa is that a lot of people do not want to share their data and even share their medical record or historical record. How do you plan on addressing that gap?
Bill, this comes to the use of big data. Sometimes it doesn't really require the clinical records that is functional. So for example, the broad history and the social network connections can reveal a lot of information.
Okay.
All right, thank you, team. We have MLP Rocket up. If you're part of MLP Rocket, please raise your hand.
Mercy?
Yes, sorry.
Quick question, logistic question. COVID truth, this is 032, right?
No, it's 0442. Sorry, there was a typo on the earlier slide. So MLP Rocket is 042.
But COVID truth, the one right before is 32, right?
Yes.
Yeah, thank you.
All right, thanks, Ali.
Yeah.
Do we have MLP Rocket here? If you can unmute yourself, whoever is presenting, and then we can get started with your presentation.
That would be me. Can you hear me okay?
Yes, I can hear you, Tariq. Awesome.
Ladies and gentlemen, on behalf of our team, thank you for giving us this opportunity to present you with a solution. Next slide, please. Fact-checking information has been and continues to be an important part of being well-informed. However, what the COVID-19 crisis has shown us is that having access to accurate information can mean the difference between life and death. Next, please. The internet is littered with misinformation. These are just some samples we received from our contacts in Africa, and I'll read one of them. Drinking bitter grape juice cures coronavirus. The rest are just as untrue and dangerous. Next, please. In order to find a solution, we had to define the problem. Currently, African smartphone users between the ages of 35 and 55 do not have a way to verify the information that they receive and share with their loved ones, especially about the COVID-19 pandemic. There are 340 million smartphone users in West and Sub-Saharan Africa, and there will be 670 million by 2025. Next, please. Meet Laura. Laura is a 45-year-old mother from Cameroon. She loves to use Facebook and WhatsApp to stay connected with her family and community. Her problem is not having a way to verify the information about COVID-19. Her goal is to have an easy, accessible way of doing that. Next, please. To help Laura reach her goal, we devised a very simple solution, an application that works in two ways. On one end, it fact-checks the information against verified databases and provides links and resources for the user to go to. On the other hand, it works with government, local agencies, and health organizations to push and disseminate correct and accurate information about COVID-19 directly and proactively to the user. Next, please. Please press play. In this demo, we show how the fact-checking process works. Next, please. Please press play. In this demo, we show how the communication is disseminated directly from the verified sources. Next, please. What makes this application different is that it proactively and retroactively
30 seconds.
combats misinformation and provides accurate information. The technology is a simple ML AI algorithm that works with a limited number of databases that have been verified and work directly with the local government agencies and health care organizations. Next, please. Laura's goal is our goal, and that is to keep her and her community stay safe during the COVID-19 pandemic and provide her with a simple solution that will protect herself from the danger of misinformation. Next, please.
That's time. So
these are our resources. Thank you, and I will take your questions.
Awesome. Thank you so much, Tariq. Judges, I'll open it up for questions.
Tariq, this is Bill. Quick question. Does something like this exist? You're a fact-checking app. So does this already exist and it's not working? So if that's true, what are you doing differently to fill that lane?
So basically what we have discussed with our mentors and contacts that we've had is that how can we do this in a way that's accessible and equitable for the users in Africa? And the feedback came in as that you have to make it a very simple application that can easily go into the user's phones and that could be then carried out to the next person. We're using the target demographic and those that we're hoping to reach, given the sheer number of smartphone users that we have. We're hoping to use them as well as the next tool that will deliver that application to the next person. Because it's easy to download and use, we're hoping that that's going to be one of the leveraging points of using this and making it work more effectively. If that answers your question.
So just to piggyback on it, I want to emphasize that point. Does the app exist already or accrue as it is?
So as of right now, we have started working, we have working models. So the algorithm is kind of starting, the first phases is starting to kind of see what that will look like effectively. We talk to AI experts and we talk to our mentors, and what they say to help the ML system learn faster is that we have to define a very selected number of databases. So the sources that it accesses are limited, and kind of helps it learn faster, and it's not overwhelmed with the amount of data.
Hi, I'm Marilyn, and I'm also on this team, and I want to add to what Tarek said. So as of now, there is no one app that people in Africa can use to fact check directly from their WhatsApp, Facebook, or other messaging platforms. Instead, they can go to Google and check that, and we don't think that that is efficient. This is why we're proposing the application. Thank you.
And there is an integration with WhatsApp, right?
Yes, please.
Is this app already something this is app you thought about in this weekend?
Yes.
Yes.
And this is and how do you plan to get people to trust the app, if that makes sense?
Yes, so we have two ways of approaching that. So our tech team also has been working on the side, creating a website that will hopefully carry the message out to the trusted partners that we're looking to reach. What we're hoping to do is partner up with established organizations like the WHO, like UNICEF, like the NCDC, that will give us that reputable background to kind of push the information through, and also use them as a means to deliver the utility in the application to the users. Because if it's coming from them, it will be a trusted source, and having them as partners will certainly help our cause.
And have you thought about what do you plan to do for the feature phones? Is there a USSD version that would work?
Thank you for that question. We actually have thought about that. So as part of our growth scope, we wanted, given the sheer numbers of smart users that exist, we wanted to get that as a starting point and then start to work our way into USSD and SMS. And hopefully once we are working with the feedback loops and seeing what the users are doing and what they're telling us, we can then refine the strategy, so that way when we get to the USSD and the SMS, we have a more refined strategy and be sending it more effectively to the users.
Okay.
Awesome. I will cut our judge Q&A there and move on to the next team. Thank you, guys. The next team is Infodemic Hackers. So if you're the presenter for that team, please raise your hand and unmute yourself. I'll scroll to the next slide and we can get started here.
Okay, hi, I'm Nudu and I'll be the presenter for this team.
Awesome.
So, honorable judges, we, the Infodemic Hackers, are here today to become a part of the solution, not the problem. So we'd like to share with you all our proposed solution to tackle the issue at hand. Next. Firstly, to walk through a real-life situation, here we can clearly see Libo, a South African woman, spreading false information about the current pandemic, claiming it doesn't affect Black people, which has caused Rusa, her neighbor, to be driven with fear and panic, and immediately she spreads the information to the community and leaves them misled and negatively impacted. Next, this is usually a normal situation, but not anymore, because we are here to change that. In our proposed solution, we would like to tackle misinformation through a unique system with a distinct plan for implementation. This is just a visual representation, but I will dive deeper into each step. Next, firstly, would be a system that would include establishing a council of experts that would review and assess the reliability of the information. Next, to begin with, we would need to conduct surveys to collect information on type, source, and information that is received by the community. Next, then the database will be formed and information will be collected. Next, after that, the information will be directed to the council of experts that will have leaders and experts with medical and health field backgrounds that will review and assess the reliability of the information. Next, then they will follow a certain scale to assess the reliability of the information and tag the appropriate rate. Development of the scale is important. This is just the first cut. So as we can see here, false would mean evidence of non-truth. Untrue means no evidence or proven fact. Somewhat means some evidence but unproven to be accurate. And factual is well-researched information with supporting studies. Next, most importantly, the community must be educated, informed, and aware of the consequences of misinformation and in detecting reliable source through different communication channels such as media, TV, social media platforms, and such. Next, the expected outcome would be to have a higher level of awareness that would reduce
the spread of misinformation, as Versa informs Lebo that her information is false and did not come from a reliable source. Next, thank you for your time, and we hope our solution has done the African community justice. If there are any points on which you'd like to elaborate, then please ask, and I would hand over the lead to my colleagues, Jeff and Nikita. Thank you. This is our team.
Hi team. I guess what we've been hearing is the part that kind of catches me is the survey. You know, the situation of trust of a survey arriving in someone's, you know, that seems to me like a big problem of how they're going to fill out that survey when maybe they don't trust the deliverer of the survey.
So Bill, I think our concept is to utilize the survey to ensure that we're developing a scale that's going to resonate with various audiences. Who are they going to believe are credible sources? Again, we feel the quote unquote council of experts will represent reliable sources, but we do want to make sure that we're responding to information that's going to resonate at the local level as well. So the survey will help inform development of the scale itself.
Thanks.
Any other questions from our judges? Sorry, I was muted. All right, we're gonna move on to Vet Africa. So Vet Africa, if you're on, I think Michelle is it? So I'm gonna scroll to the next slide and then we can get started with your presentation.
I'm ready when you are, if you can hear me.
Yes, I can hear you.
Excellent.
We're ready.
First slide. Greetings, judges. We are Team Vet Africa. We have developed an application to deliver trusted information to vulnerable people in remote areas of Uganda. Next slide, please. We plan on working with and incorporating information from the local Ministry of Health in Uganda, Africa CDC, WHO, as well as community leaders. Our application pulls in API data and uses artificial intelligence to respond to queries in real time. The idea for our application came from my friend, my coworker, who lives near the capital city of Uganda. She relies on much of her information about COVID-19 from community speakers that are lifted high up into the air and loudly broadcast information each morning from a community leader, a Christian leader, a Muslim leader, and sometimes a medical professional. Our application can overcome those barriers to communication. It does not rely on the internet, and it can overcome education and language barriers by being easy to use and using plain language. Sometimes Joan hears a song in the afternoon that tells her that someone has died from COVID-19. Next slide, please. Our app can help us dispel information. Our primary target is people with no internet access, as it is a USSD application and can reach about 15 million people in the population of Uganda, and another 5 million with internet access or smartphones can also use our application. Next slide, please. Is a chatbot solution with USSD functionality, and we use reliable sources like API data feeds from WHO and can formulate responses in real time. Channels exist for toll-free call centers, and we can incorporate officials by referring people to call for more information, and certainly they can refer people to the app for answers, for quick answers. We plan on incorporating online and offline interactive community groups as the app rolls out and is adopted by more people. It can be GIS enabled for people with internet access and smartphones. Next slide, please. Our app is different because it does not require internet function. It can be scaled out to languages. We move to a larger platform. We expect to roll out in about 3 weeks. We do have a working prototype. And if we move to a larger platform, we can expand languages. We can incorporate into existing telecoms. We've already reached out to an executive at Afritel for a buy-in for it, and he was on board with us. And we are incorporating artificial intelligence and a geo function, a GIS data for scalability and appeal to more users. It can be easily transferred to anyone in the government sector or private sector for use and roll out to other countries. Do you have any questions?
Awesome. Thank you, team. Judges, questions?
From my end, I mean, it's about scale. So you say it can be easily scalable across different countries. Can you just give a bit more detail how you plan to do that?
Yeah, I can answer part of that, and I think Ike will jump in and answer part of that as well. So we developed an app over the weekend as a prototype, which you can visit at a URL that we could send to you. And then we found that we could move on to a Google platform and then automatically scale to about 23 languages pretty easily. Ike, do you want to answer that as well?
Yeah, good day, judges. We are planning to scale out on the solution by leveraging on the Google Cloud platform. Currently, it supports up to 23 different languages, and using the natural language processing algorithm that we are planning to build into our chatbot, which will connect with the USSD, we think it can also be scaled to the local languages.
Hi, this is Ali. How do you address the literacy gap in Uganda? Do you have a way for those that don't necessarily want to text to communicate via audio?
We do have some pre-programmed responses in there besides the API data to incorporate some advice from like Uganda Health. So we can have information there from community leaders that they're currently giving their information via the speakers. So it's possible for them to have a pre-recorded message or a pre-recorded written message as well.
Yeah, I'd like to add to that as well. We'll be leveraging on the community leaders. I believe that in most of those communities, there will be at least 1 or 2 persons who is literate enough to understand basic English. So we'll leverage on the person, teach the person how to use any kind of phone that doesn't have internet access to connect to our chatbot. And then the person, we can work with the person to share, to spread the word to other people who do not necessarily have the literacy to use our bot.
Okay. All right. And what about as far as the rollout goes, do you plan on partnering with a telecom operator in Uganda for the Massify effect, or do you plan on just going private and deploying it yourself?
No, telecom, because MTM CEO has already donated, I think, like 500 million Uganda shillings, and so we expect to buy in there. And then the exec that we contact, our teammate contacted at Afritel, also said that they would be on board with it.
Okay.
Yeah, I'd like to add to that as well. We've already reached out to a telco executive who works with Airtel. We discussed the solution we're looking to build with him, and he actually confirmed that the infrastructure already exists to integrate our chatbots with the existing USSD platform they have. So we're also looking to work with the governments of various countries of the Uganda to also enable us to operate in their country as well.
He's right. It's Airtel. I keep saying Afritel. Too many telecoms this weekend.
No worries. So we're gonna cut it there because we're running a little bit over the Q&A. I would like to invite the next team, COVID-19 reality checker. If you can please raise your hand if you're the presenter, Myra, and then unmute yourself. I'll move on to the next slide and start your time. And if you're not presenting, please mute yourself so that we can give the teams the floor, essentially. COVID-19 COVID-19 reality checker, is anybody there?
Yes, here. My name is Myra. Hi, everybody.
Good, awesome. So I'm gonna flip to the next slide and we can get you started.
Okay. Hello, everybody. This is the presentation of COVID-19 reality checker. Next, please. Our problem is that we have a high volume of misinformation around COVID-19 pandemic. Next, please. The statistics from Oxford and Reuters Institute show that 59% of the information is reconfigured and the other 38% is fabricated. Next, please. We propose a centralized solution, artificial intelligent chatbot. We can already, somebody's talking, sorry.
Oh, go ahead. I'll add
okay. Okay, we propose a centralized solution, artificial intelligence chatbot. We can answer a wide range of questions about COVID-19, give real-time statistics for any part of the world, and validate the authenticity of news articles provided by any website. Next, please. Our chatbot can work in very different delivery channels, USSD and IVR, mobile or web application, even social media messages like WhatsApp or Facebook. Next, please. This is an overview of our chatbot that we have already developed. Next, please. But let's explain how that we are different from other solutions. We are using multiple delivery channels so we can reach different socioeconomic populations, as not all the people in Africa has access to internet. Very fast task competition speeds, multi-language and versatility in information validation. Like this, we could shut down fake news. And we reach different groups of people as we develop an option for health professionals so we can share with them scientific documents on biosafety advice. They are a very susceptible group and we need to protect them with a specific knowledge. It is important to know that even if we have an appropriate PPE, if you don't know how to use it properly, it can lead to contagion. Next, please. We are targeting 30 to 35% smart user phones, 45% online users, and 25% offline users. Next, please. Our scale-up plan revolves around promotion of the solution via multiple channels and carrying out continued user satisfaction surveys. Next, please. Additional support areas are going to be needed: promotional support, partnership, and mentorship. Next, please. That is our wonderful team. Okay, and next, please. That's our team next steps. We need to acquire enabled funds, finalize developed works, translate to multiple languages, finalize beta testing solution, and extend to the public. Thanks for your time, and thanks for MIT for this opportunity.
Thank you, Myra. I would just
You're
like
welcome.
to reiterate again, if you're not presenting, please mute yourself, because it's really unfair for the other team that's presenting to be interrupted with people talking in the background. Otherwise, I'm going to switch it over to judges for 2 minutes feedback.
Okay. Hi, thanks so much. I have a quick question about how do you gain access into this space of becoming that app when there's, you know, the trust issues, who's allowing you to access this to people so they trust your app?
Isaac, you want to answer that?
Oh, yes, I can answer that. Yeah, when we have a wide range of options.
I didn't hear.
Hello, can I step in?
Yes,
yeah.
please.
Yeah, basically, it's a chatbot that we've already developed. We had a demo about that, and the trust issue that we plan to partner with WHO and some organizations that are national in levels, and most of our information that we get for the chatbot is script from WHO API sources. So I think the trust there is for the information is already there, and it is comprehensive because it touches every facet of society. Be it you are illiterate, you'll be using the USSD or the IVR, which is the integrated voice recognition. And if you are a younger smartphone user, WhatsApp, we plan to integrate our chatbot with WhatsApp, which is going to provide question and answers on certain topics about COVID-19. And also, what is interesting about it also, you have the opportunity to also fact check certain news articles that you receive. You'll be able to send a particular URL, and we'll be training a machine learning model, which will take the URL as input and try to extract certain keywords, their data in the article. And we already have a data set ready in Kaggle.com that we will compare there and try to, because we know that for sure, the difference between a fact, a fake news, and the real news, is certain keywords that they use, certain keywords. So based on that, we calculate the probability of it being real or fake.
This is Ali. Real quick, two quick questions. One of them is you mentioned training the model. How do you plan on training the model on the ground? What's the plan for that in terms of timeline? How long it would take? And you also had an IVR solution. Usually chatbots with IVR are expensive in Africa. how do you plan on addressing the the cost of using an IVR solution for a chat box?
Well, basically for training the model, there is already an existing data set that is available at cargo.com, like I mentioned, where there is a competition there that they launched a while ago that avails certain information about news. And we plan to use that particular data. It's over 30,000 rows, 50,000 rows, that to 50,000 rows. So we plan to use that particular data set to actually come at a solution that the accuracy level will be high. And concerning the IVR solution, it is not, well, that my team partner would have answered that. I think he's having some issues.
Yes, I can come in. I can come in. To do it.
Jacques?
Yes, someone doesn't need too much training to get around with it. And IVR, of course, we're going to partner with other organizations to deliver a product better, to minimize the cost that we can involve in delivering the product.
Awesome. I will put a stop to the Q&A there because we're running a little bit behind. But thank you so much, team, and thank you, judges, for the questions. I will roll into Veritas. If you are the presenter for Veritas, please raise your hand and we will move. Thank you, team.
Hello.
Yes, we can hear you.
Okay, great.
All right.
Ready when you are.
Awesome.
Veritas, the Roman goddess of truth. Truth and facts are key weapons in humanity's fight against the global pandemic. Unfortunately, these weapons are lacking in Africa, where governments are untrusted and internet technology is inaccessible to most. In fact, a landmark study of 2019 found 43% of social media users admitted to sharing inaccurate content themselves. This is why we have Veritas, a website that will act as a news aggregator between reliable news sources and local newspapers, radios, and news channels, a business-to-business model. Next slide, please. Here is our three-pronged plan. We plan to identify potentially fake news using comparative algorithms, provide factual content from reliable sources to outlets easily, and use machine learning to create a rating system for news. Next slide. The first part of our plan is continuous web scraping. The way we do this is by comparing keywords in the user search to keywords of articles. Next slide. We then use our algorithm, which considers 3 factors in order to determine a percentage accuracy to flag the source into 3 tiers, as we will show. These are the source credibility, which depends on how accurate it's been in the past, the agreement of comments on the source, and a keyword and phrase match to credible sources. In the future, we hope to receive help from health officials to give a percentage rating for certain user searches if our algorithm is unsure. We hope to target news agencies in Namibia, since this is the country with the highest press freedom index in Africa, and newspapers play a large role in how the public receives information, which is why we will be able to create maximum impact in combating fake news. By allowing news agencies to check the information they send by Veritas, we can ensure that people in Namibia only receive factually verified information regarding COVID-19. Next slide. And please play the video on the next slide as well. Here we have a demo of our website. It's loading. Okay, so this is our homepage. As you can see, we have the first article, which has received a 12% rating as it claims that a vaccine has been released, which isn't true. The second has a 47% rating because it has a death toll statistic. And the last one has 92% because it is proven to come from a reliable source. Next slide, please. Here is our timeline and budget. We plan to initiate the project in Namibia to start with, spending $100 a month on website maintenance. We'll also partner with health officials. Within 2 months of its inception, we plan to ink deals with local news outlets such as Namibia Press Agency, Insight Namibia, etc., as a reliable news aggregator. As the system load increases, we will need to upgrade to a paid service, $9.99 per month for Microsoft Azure for the AI, And finally, around the 6-month mark, we plan to expand the project to other countries in Africa, acting as a general news source as COVID-19 dies down. Next slide. Thank you.
Awesome. Opening it up to judges for questions.
Hi team, this is Ali. Do you have a mobile version in the works as well?
Not at the moment. Right now, our plan is only as a website because we want it to be accessible to news agencies and news sources. So we thought that a website would be most apt for a business-to-business model.
Okay.
Any more questions?
Okay. From my own end, it's just to look at, you're looking at Namibia for all of this. What's like the penetration level in Namibia? Have you considered that for those without deep internet? Yeah.
Devan, Prashant, would
Yeah,
if you would
I'll
like to.
answer. So your question, I'm just confirming, your question is, what about the people who don't have internet connection? Or was that what you asked?
My question is about those who don't have internet connection. How does that look like for them in some sort of way? Yeah.
Okay, so for those who do not, I mean, we are targeting, it's a business to business model. So we are targeting news agencies in Namibia. So those are the ones that can, because news is a source that is accessed by most people in countries like Namibia. So because it has the highest free press index in Africa. So we target the news agencies, which will spread the news to all the people in Namibia through radio or whatever medium they choose.
Awesome.
As the influences the people, yeah.
If there are not any other questions from the judges, I will call up Impact 20. If Impact 20 can raise their hand in the participant view. Raphael, awesome. You can unmute yourself and we'll move on to the next team. Thank you, team. Thank you, guys.
Thank you.
Hello, can you hear me?
Yes, we can hear you.
Okay, so we have heard a lot about it. 5G causes COVID-19, hibiscus tea cures COVID-19, Black people are immune to COVID-19. This misinformation comes in various shapes and forms from a plethora of sources. So this is our proposed solution to combating misinformation in this time of the COVID-19 pandemic. We are going through the policy and community development pathways, presenting a pragmatic and cost-effective implementation and consumption mechanism. So summarily, like the prompt suggests, we are seeking to target vulnerable population of people who are down the socioeconomic ladder. The problem is that, the next slide, please. Okay, so the problem is that we would like to emphasize that we are supposed to solve misinformation, not lack of information. So this suggests that there are a lot of information available to this population in one way or the other. Our focus will be to sift the chaff from the wheat. These may not have internet access. I mean, these people may not have internet access. They cannot afford mobile phones in many cases, not to talk of high telecommunications tariffs. So we think that it will be counterintuitive to keep adding more information channels and other high-tech devices or mechanisms as well. Now to the next slide. The cause of this problem, we realize, is the lack of a centralized source of information. This makes the people susceptible to viral misinformation available to the public. So as a solution, in the next slide, we are proposing the formation of a non-partisan local task force. This is composed of community leaders, because no matter how knowledgeable you are, you can never know more than the indigents and their leaders, who are often more respected than local authorities. They will also have academics who will be doing the high-level tracking and observation of the hotspots and the shape of the curve as well. Health practitioners will curate and collate information from reliable sources like WHO, CDC, the West African Health Organization, and many more. So to the next slide, we are looking at the way that information will be disseminated. We think that the most pragmatic, the most cost-effective and efficient way would be through the state-owned medias, because TV and radio networks have deeper penetration than mobile networks, and TV and radio sets are cheaper than mobile phones and more accessible. So to the next slide. We are thinking that on top of this, the way the content will be structured must be culturally and linguistically relevant to them. They must be musical because catchy jingles also sell a lot, and they must also contain impactful and emotive videography. Thank you.
Awesome. Judges?
Hi guys. So what's different from your task force? You know, okay. We've seen a lot of different task force across Africa. Some of them put together by governments, other by NGOs. What makes yours unique, and how do you plan on scaling it on the ground?
Okay, so this task force is that most of the time, the ones that we've observed are task forces that are formed by the government, or task forces that have that are political. Let me put it that way. This one is going to be a non-partisan one, which is made up of experts who are bringing experts or objective opinions to it. We know that politicians can do anything to get re-elected, even if it means misinforming people or understating the figures so that it looks good in the eyes of the people. So this one will relegate the activities of the government so that the government will just be the support of the whole system.
So how do you plan on doing it if you're partnering with state-owned media?
The state-owned media, the content will be supplied to them by this non-partisan task force. So it's not like the government that is deciding what will be disseminated. It is the task force that is dealing with the state-owned media. So they're just using them as a means of communication. The government will not have any say in what they do.
Okay.
Just to jump on there on Ali's, Ali, is like this kind of task force takes a long time, or in general, to get together, to put in, to implement. This is so do you have an idea of a time length to get something like that up and running?
Okay, so we looked at a conservative timeline of about two weeks to get this done, because we are not looking at an extremely complex network of people. We need academics who are already grounded in statistics or health statistics. We need health practitioners who are already on the ground in the local authorities. And we also need the community leaders who will get us the buy-in from the people. So there are the chiefs, there are the local administrative leaders, there are the local health practitioners, and there are the academics as well. So we do not anticipate difficulty in getting the buy-in of these people to help in this crisis situation.
Awesome. Thank you, team, and thank you, judges. We're going to move on to AltLearn. So if you're the presenter for AltLearn, please raise your hand on the participants tab and get ready to unmute yourself so that we can get your presentation started. AltLearn?
Yes, I'm here.
Awesome. I'm going to set up my timer and flip to the next.
Well, she has to
Okay,
share her
I think I first have to share my screen with you, right?
Yes.
Okay, please share. Okay, let me start share screen. Yes, okay.
We still can't see your screen, so I'm going to stop sharing.
You're viewing.
Okay, is it okay for you?
Still
she says it's...
Yes, there you go.
Can you see my screen? It's okay?
Yes.
Okay, perfect.
If you don't mind on presentation mode, that would help our judges see the content that you guys created.
Okay, of course.
This is J23, right, Mercy?
Elizabeth, can you check that?
Yes.
It's charging, sorry. Going to
Yes, correct. J23.
Thank you.
Not a problem.
Okay, so I'll start my pause. I'll pause it. Sorry, it's going back. So my daughter, the team is Outlearn. So my daughter is 8 years old and she came from school a few weeks ago saying that COVID-19 don't exist because her friends tell her COVID-19 don't exist. So I realized that 41% of the African population is under 15 and is not targeted by communication on COVID-19. Therefore, they can easily transmit the disease without even knowing it. So we have decided to build an innovative book that includes a speaker. So the speaker is, okay, so the speaker is here, as you can see it. And the book is a comic book that can be, excuse me, the book is a comic book that can be translated in different languages. So you can see in the left that it's translated in Douala, local languages. So the book highlights the barrier gesture against COVID-19, and we can do a lot more books about that. So the solution is to work with NGOs, government officials, but also companies to help them and schools to help them target the children with materials and content that we will be building, and those contents will be adapted to the children. We realize that it's also a good market opportunity because it's a 1 billion market in Africa. Education is a 1 billion market in Africa, and we expect by 2023 to do $20 million. So we will sell our books through different platforms, a platform that we have set it up and where NGOs, for example, like UNICEF, can come and order the books to distribute them to vulnerable populations. We will also be doing ads and etc. So we have already touched 3,000 parents, and we will strategically launch in Cameroon, where, as I said, we targeted successfully 3,000 parents, and we will be working with NGO, and we will leverage the use of internet to translate our books all over Africa. So that's pretty much it. Our next steps is working with partner, improve the platform, print and include audios in the book. So we are working with engineers, local Cameroonian engineers that have made this audio speaker, and it won't be expensive to build them. So that's it.
Right. Thank you, guys. I'm going to turn it over to the judges for questions for 2 minutes.
Hi guys, this is Ali. So book publishing, there are a lot of challenges with book publishing across emerging markets. One of them is the cost of printing. Another one is shipping. How do you plan on addressing those specific challenges?
Okay, so I run a magazine which is called Ma Famille, and we are distributing the magazine in 3 different countries. So I have partners, so I know how the printing works, and I have partners in those different countries. So it's no more a challenge for me, and I really can have low prices.
So do you print locally in Africa, or do you?
Exactly. The issue with printing locally is the quality of the papers. But when you work with partners that you've already been working with, it's okay. But it's cheap to print, and it's cheaper than printing in Europe, for example.
Right. In terms of the distribution model, do you keep the stock on the ground, or do you have an on-demand model if UNICEF wants to, acquire 1,000 books?
Yes, it's completely a non-demand model, because let's say, for example, UNICEF come to us and say, okay, we want 3,000 books. It will be very expensive to keep those 3,000 books in a storage or something like that. And what is really interesting is that we can build and fit the content as companies, schools, or parents come to us. they can say, for example, okay, we are addressing COVID-19. Information has changed as the disease is changing. We always have new information. So if we need to put more information, our content creators will put them in the book, and we can change them, and we can expand it to malaria and other diseases.
All right.
And
Do we have
who
any
are
other
the writers and the authors of the books?
Excuse me?
So who's going to write the book, the artist for the comic version as well? Are they all based in Cameroon?
No, not at all. For example, we have made, okay, we have made, excuse me, sorry, we have made a Wolof version of the coloring book a week ago, and it was with Senegalese people. We have artists based in France, we have artists in Cameroon, and in our team we also have a medical illustrator, for example, and the web designer.
Just a quick question from my. I'm sorry, I'm having some bad. I have someone in my same house having the call, and I think it's just about scale. I mean, how do you think about other countries, other languages? Have you thought of that? I mean, what's the possibility of this? Yeah.
And can I also ask a question about what happens when the children don't have crayons or coloring? Is there a version of a book that would still be interesting?
Yes, completely. We have done, the idea is to do tales book, coloring books, but also normal books, and not only coloring, of course. We can actually order the colors to give it to them, but the idea of the whole stuff of the platform is to have a creative and entertaining way and ludic way to address the children, so it can change depending on the children. And excuse me, there was another question. I think it was, how can we address other countries with their languages, I think. As I said, for Wolof, for example, we have a Wolof version, and we work with an association that is dedicated to spread Wolof through Africa. So that's what we did. And for example, in Togo, we are working with people. Togo has do Mina. The language is Mina, but it's not written. So we write in French, and they speak in Mina. That's one of the reasons why the audio is so important, and also because everybody doesn't read, but everybody see the images, and the audio is important for the population we are targeting. The parents too can read sometimes.
Awesome. Thank you so much for the questions, judges. Thank you, team. We're going to move on to the next one. Kushinga.ai. If you're the presenter, please raise your hand. Thank you. Thanks for taking control of the screen.
All right. My name is Brian Davis. Can you hear me okay?
Yes.
All right. I'll get started. So our innovation is a discussion chatbot called Kushinga AI. Next slide. Our problem is the increased risk of intimate partner violence during pregnancy, compounded by the need to quarantine during COVID-19. Pregnant women and girls are confined to spaces with their abusers, limiting communication channels, which creates misinformation. Next slide. The rates of IPV during pregnancy in Zimbabwe are among the highest ever reported globally. Our target population is teenage girls and women between the ages of 12 and 21 in the township of Mamvuku. So why Mamvuku? It is a rural migrant population. It has a rural migrant population with limited resources and a high rate of teen pregnancies associated with IPV. Next slide. Our solution, Kushinga AI, is a chatbot which leverages SMS and artificial intelligence to inform and provide resources for pregnant IPV victims. SMS is used to provide a silent channel of communication for the victims in a question-response format. The back end of Kushinga is a sophisticated serverless AI that can serve up text responses based on discussion and images for those with low literacy. So what does our sustainability model look like? Well, first, we're building a strong community base with social media, flyers, radio, and clinics, measuring impact through understanding utilization in certain areas and pregnancy outcomes. We plan to scale inside Zimbabwe and to other African countries. Outcomes will be measured based on the reduction of disability-adjusted life years. Kashinga will have a massive short-term and long-term impact now for COVID-19 and in the future for extending support to survivors. Our implementation timeline is here for rapid response. Our MVP has already been created. I've already created this domestic violence chatbot for another application. It would be very easy for me to retrofit it for this population. The next steps include creating a strong community base and piloting our MVP. Next slide. And this is our team. Mercy, I can't hear you.
Sorry, opening it up to judges for questions. I was muted.
I'm gonna jump on where Ali asked this question on another team. Is chatbots can be sometimes expensive in Africa. So how are you thinking about that?
Expensive. Well, the chatbot technology that I'm going to use is serverless, and it's really cheap. And I've actually implemented it for a city in the UK with a population that's much bigger than the population that we're looking at. So, and it wasn't expensive at all.
Just a quick question, just to clarify. So I get the link with pregnant women. Could you explain a little bit more how the app and the solution would support?
Sorry, do you mind repeating that last part?
Yeah. So could you explain how the solution would help combat violence against women?
Well, so first of all, it kind of gives you a background in terms of it allows pregnant women who are IPV victims to kind of ask questions about their pregnancy, and also has the ability for help. So if they don't feel like they're in a safe location or they don't feel safe, we could also link that with a medium to alert authorities, or at least alert them of the location that they are and what is going on in that situation.
Yeah, when they're trapped at home with their abusers because of COVID, and they have COVID-related questions to about their pregnancy, then it's easy to get misinformation because they don't have a channel of information. So that's what we want to provide to them, and it's important that it be silent so they don't have to actually make a phone call. They can just text.
Awesome. If we have no other questions, I'll move on to team 34. Thank you so much, team. Team 34, if you're the presenter, please raise your hand and get ready to unmute yourself for the presentation. Team 34, I think that's Yao and Margaret.
Yes.
Awesome.
Hi. Yes, I'm here.
All right, so I'm
Thank
gonna,
you.
yeah, I'm gonna flip
Thank
the
you.
next slide and we can get started here.
Right. Thank you, team. Right. In the era of pandemic. Hello?
We can hear you.
Hello?
We can hear you.
Can't see the slide. Right. In the era of pandemic, there is always problem of knowing which information to trust. And because of that, we feel there is a need to get back to the community. I can't see the slides. Can you?
You just have to say next and I'll go to the next slide.
Right, okay. So what we're saying is our governments are doing the best they can to combat the spread of the disease. But with social media, smartphones, it's easy for anyone to generate information and send it. Next slide, please. So what we're proposing is to go back to the community, to the people who are receiving the messages from our government. Next slide, please. To find out the effectiveness of the measures that our government and other stakeholders like NGOs are putting in place to combat this disease. Next slide. Now, if we're able to do that, it means that our government, stakeholders, and others will be able to identify the gaps in the information or messages that they are passing on to the communities. They will be able to know the perception of the citizens concerning the disease. Next slide, please. So our approach is to administer electronic questionnaire through trained enumerators. These trained enumerators will go to the field with smartphones and tablets to collect the data, and then we analyze and present the data to all stakeholders. Next slide, please. The tools we're proposing to use, or the tools we are using, are readily available and efficient data collection and analysis tools, which are ComCare mobile data collection platform and Tableau software for data analysis and visualization. Next slide, please. Next slide, please. The structure of our questionnaire will be in two parts, because here we've identified two entities, the general public and businesses. For the general public, our questionnaire will center around source of COVID education. Right. And then for the businesses, especially in Ghana, where we have asked, the government has asked that people should use Victoria buckets to wash their hands. We want to find out if they are actually implementing that. And for those who have not seen Victoria buckets, we have an example there. And as I said, we're going to send people to the field to collect the data. Thank you.
Thank you so much. All right, we're going to open it up to judges.
So yeah, thank you for the presentation. So there are a couple of mobile data collection platforms and companies out there in Africa. Even telecom operators are launching their own services. What makes yours unique, and how do you stack up when with the competition?
Right, as I said, we're using tools that are tried and tested. ComCare is known everywhere. In fact, I've used ComCare for the past 6 years. I've worked in 15 African countries, training national statistics officer staff for data collection, data analysis. So what makes it different is that ComCare is tried and tested, and we're using the free version of ComCare too. So it's not going to cost anybody. Likewise, we're using the public version of Tableau for the analysis and visualization.
And your target market is Ghana, correct?
Not really. We're doing Ghana. In fact, as I speak with you now, I was contacted by OECD, the Organization for Economic Cooperation and Development, the head of African statistics. He contacted me last week to find out what we can do for Africa using teaming up with the national statistics offices on the continent. So it is not only for Ghana. The reason I mentioned Ghana is that in Ghana already the Minister for Information and the Chief Director for Monitoring and Evaluation, they've already sent me their reports, because I've done the questionnaire. They've sent me their reports, so I'm going through to see if I can actually answer all the questions for them.
Awesome. Do we have any other questions? Sorry. Great, so we're gonna move on to team 20, Info Combat. If you can raise your hand, we'll get you set up and move on to the presentation. Info Combat, awesome. Oluluken, do you wanna unmute yourself and then I can go to the next slide and get you started.
Hello.
Hello, we can hear you.
Yeah. Okay. Combating misinformation. The fight against the unknown continues, and misinformation stands as a challenge in winning the fight. Next slide, please. Here is a little bit of comic relief. We could see a picture of the mother and the daughter. The daughter asking the mother, why is she not on her phone as often? And we could see the reply saying she's kind of keeping social media distancing due to the fact that fake news are flying all around. Next slide, please. What is misinformation? We must know what the challenge really is. Misinformation simply means less information, no information, or wrong information, and they have another parallel pandemic alongside the COVID-19. And social distancing makes people unable to verify any information they receive. Next slide, please. Questions remain unanswered. Equity and inclusiveness. Most solutions proposed require people to have basic literacy and have access to internet and mobile phones. What about people who don't have access to them? What about people who don't have electricity in their house? What about people who don't have basic literacy and don't trust any information due to already flooding fake informations? Here in Africa, we know about 42% of people live on the less than $1 per day. How can they afford technological gadgets or digital gadgets? Next slide, please. Solution. We as a team, we actually leverage on the tertiary cost implementation of leveraging already existing traditional and trusted information networks via our religious institutions and radio networks. We all know that in the community, we will find at least 1 to 3 religious centers or institutions around such communities. So by this way, we look at disseminating information via this means, all speaking and communicating in different local languages, and of course the radio networks too. The radio network is very wide means of passing information, and of course is this cause kind of a way of listening to information and connecting governments and educational institutions with these networks to serve as information source. Next slide, please. How it works: you can start an implementation in a country or a community without involving the government. So here's the chart: the government
15 seconds.
Straight to the university, providing us with verified education, verified information, straight to the radio stations, religious institutions, and disseminating via radio to target markets. Next slide, please.
5 seconds.
Next slide, please. Equity and inclusiveness advantages includes men and women who are not covered by internet and electricity, being native, information on local languages and songs, trust, scalability. It's scalable to all area and any size that is separated into clusters around an information source. Thank you.
Awesome. Open it up to the judges for questions.
Hi guys, thank you. Could you emphasize the correlation between the lack of internet and electricity and your solution? What's the relation there?
Okay, we're looking at a means of disseminating information to people who don't have access to internet connections, who don't have access to electricity, people who live in remote areas, who are not literate, people who can't read, who can't write. So religious institutions and radio networks will be a means of disseminating information to them. It doesn't require an internet. It doesn't require electricity. All it needs is just a battery in their radio and their output. And we will agree that most individuals living in less privileged societies, they do, or one thing they do is listen to their radios. They have one specific channel they enjoy a lot. By so, we could disseminate information in various local languages, which they would understand and be educated.
Right. So that's currently the purpose of radio networks, right? So what makes your solution unique from what radio broadcasters are already doing?
Okay. We're gonna set up a monitoring team that will help in making sure that this implementation is actually on point and disseminating the right information, providing them with necessary information and authenticated information, not just listening to any news via the radio.
So you said providing them with necessary and authentic information.
Yeah.
Where will you find that? How are you going to capture that information? What's the?
Can I come in
that's
from
what
there?
we're looking. Yeah, you can.
Okay, thank you. Yeah, my name is Mario. We'll be working directly with the disease controlling board to collect the information. What we're doing is we are leveraging on their core values, because people in Africa don't want to believe the government says. Everybody knows that. But they will believe what traditional leaders, they will believe what religious leaders, and most especially, we are leveraging on pleasures. We are making use of entertainment industry. We are making use of the actresses, the popular ones, to come on radio and explain in local dialects what's and the consequences of misinformation, and help us pass across this information to their people.
Okay.
All right. Thank you, judges. We're going to move on to the next team, COVID Truth. If you could raise your hand and unmute yourself so that we can get your presentation started.
I think they already went through, Mercy.
Oh, COVID Truth?
Yeah, we already went.
Oh, okay. Sorry. I don't know. Oh, it's because I'm resharing. My bad, guys. Let me just exit this. All right. Team blue and gold. If you're there, raise your hand.
All day.
Hey, can you guys hear me?
Yes, we can.
Cool.
Mercy, what's the number, real quick?
For blue and gold, it's
Yep.
number 2.
Okay.
Yes.
I'm sorry, what did you say, 2?
2, yeah.
Thank you.
Mm-hmm. Can you guys see my screen, or am I sharing right now?
We can see it now.
Okay, good. All right.
Greetings, everyone. We're team number 2, blue and gold, and we're presenting you with Precision Bridging W2A. Next slide, please. So one of the causes of misinformation is lack of accurate and first-hand information, which we want to address the information gap between local communities' needs and the manufacturing or task capacities. We aim to develop a reliable information source for COVID-19 in Africa. We observe that a one-stop information hub for allocating critical supplies does not exist at this moment. And that sums up our problem statement. Moving on to next slide. So what is our solution? We propose our product W2A, which stands for We to All. It is a platform aiming for bridging the needs of local communities to suppliers or donors who have the capacity to mitigate the gap in a precise way. Hospitals, charities, and NGOs who are striving to combat COVID-19 and provide care and support to local communities can express their needs through the platform. The information is made available to potential suppliers and donors, including manufacturers, organizations, and individuals. And moving on to next slide, we have our product demo. Would you mind clicking play for us?
Here's the homepage of our project. We have 3 options. The first one is for general users looking for information on COVID-19 in Africa. The second one is for healthcare providers or communities who need resources assistance. You can click on the second icon, which will direct you to the form where you can type in your specific needs and contact information by filling in the questionnaire. The third one is for goods and service providers that are capable of fulfilling the needs. If you're someone who'd like to provide, you can will the request from frontline workers ordered by supply categories. For example, if you're looking to provide medical supplies, you will be directed to a page that has different hospitals and their contact information listed. From there, you can click the Help This Organization link and start to contact the hospital.
Yes, next, so that concludes our demo, and moving on to next slide. Some of our next steps, including expanding our platform to include more countries and regions for our information sources, and we want to add more languages. Also, we want to add this request verification function so that we can verify the requester's authenticity. And the very last one is create a lighter version of website for people with limited internet access. And that concludes our presentation for the product. Thank you very much.
Awesome, thank you, team. I'll open it up for questions from judges.
Thank you. Have you thought about how donors will verify that recipients are using resources in the way that they requested?
Sure. We have that concern too. So that's why, so for in the next step, when we see request verification, we definitely want to add that in the future steps. And also we also planning to add like a status check for, it's like a real-time form being displayed on the website so that, try to provide more updates. For example, for the hospitals, for people supplying critical medical supplies, we're trying to protect like status track for them. So that will be our next step. We didn't have time to like implement that, but yeah, we have that concern too. Thank you for bringing that up. Did I answer your question? Do you have more follow-up questions with that? Thank you so much.
I'm curious about like scale because it's an interesting website with complex networking with service and hospitals and that whole where you put something on the web about what you need. I imagine something like that's already trying to happen. So I don't know how. Like I'm just wondering how you will kind of jump a generational jump and make this work.
Yeah, sure. Regarding to scale, because we realize even though we are trying to solve like the COVID-19 challenge at a continent-wise level, but we realize like, within the continent, like the difference between countries are still very significant. For example, language could be a barrier. And also, for example, so for this one, we specifically studied Nigeria because it has one of the largest population in Africa and also highest infection rate at this time. But we also need to consider that because of the difference between country and also like the situation they're facing are quite different, and also like the population structure and also the economy, like the impact on economy they're facing. So that's why so there are so many. Yeah, as you mentioned, this function, this kind of website is not new, but the problem we're trying to scale up is like technically this when we're trying to scale up, we need more servers to support, and also we need more people to help us to maintain this website. And second one is like the language barrier, as we mentioned. And third one is like we really need to cooperate with local organizations, with local charities and churches and representatives from local health, like disease control, to to get better understanding of what specific needs from the local people, and try to contact local manufacturers to see if we can do more customization for the local communities and more regions.
I also want to add one more point to that, is that for assisting the local hospital, we are not providing the information, but the hospitals or the other organizations are providing the information to us. So our job is to verify if the organization is the real organization that are aiding COVID-19.
Okay, thanks.
Thank
Awesome.
you.
Thank you, team. We're going to move on to team 30. Last but not least, COVID engaged stakeholders. Thank you so much for the other teams for actually taking the time to watch other teams' presentations. The camaraderie has been great, and we appreciate your time. All right, so let's see who's going next. Victor?
Yes.
Awesome. All right. Whenever you're ready.
Yeah, set. Yeah, thank you. My name is Victor. Good evening all. I'm presenting on COVID-19 stakeholders engagement play role. The problem. Next. Yeah, the agenda of the presentation. Next. Yeah, this is the problem. Misinformation, COVID misinformation. Misinformation generally doesn't mean the news are the facts are fake, or the news or the informations are fake or false. It's when people are not carried along in part of that, the outcome of that decision. And for instance, the COVID-19 misinformation came from issues such as the major stakeholders, which are trying to protect their livelihood, their business return on investment, their health risk, and the inefficient and palliative distribution. Next. So how do we look at this? The major stakeholders in this, that majority of them are left behind, but just been decisions are being made by just two of them, the policy, the public workers, and maybe the government. The others are not being carried along when they are making decisions in relation to the issue of lockdown. Next. Next slide. Now, solution. The solution is coming up with the team came up with a plan to develop an application which will be using the SEIR model, simulation model. So take the input from the major stakeholder using the stakeholders input sliders, and then come up with different simulations so that each stakeholders can then see the consequences of their decision. They can preview the consequences of their decision before the actual implementation. And we also have some materials to develop some material, which is like a stakeholders brief, the fact sheet about COVID-19, and pre and post survey for the stakeholders. Next slide. This is the structure, the model, the structure of the application. Next slide. And this is the decision interface of the stakeholders, where the stakeholders will be able to make use of that slide under to predict their decision, whether to continue to lock down or to ease to lockdown, when to ease the lockdown. Next slide. Next slide. Yeah, this is the outcome of their decision. That is when the stakeholders see that, okay, no, back.
You have 5 seconds.
You have taken away the slide. I can't get the slide. Okay, when the stakeholders will be able to preview the action that continues, and their inability to take proper action or quick action will lead to the graph B. So I believe that will help them to make a quick action, and this will be hosted on Folio app. Thank you. That's all.
Awesome. Thank you, Victor. I'm going to turn it on to the judges.
So this is Ali. Thank you. It seems like the success of such a solution would heavily depend on some sort of national partnership with the government or government agencies. How do you plan on cooperating with them? Do you have a partnership engagement framework in mind?
Yes, the first set is to complete the app. Once you're able to finish the application, which is self-explanatory, and also develop the role play around it, develop some kind of brief, a kind of play, so that each stakeholders can have a role to play in this sliding, and then we'll try and establish a contact with the government, and then before they move to the community, to inform the community of this is the number of days we want to do the lockdown. The community will be able to say, look at the effect of allowing the government to do the lockdown or not.
Okay. What's your target country?
For now, we try practically looking at to start it from Nigeria, because many of the African countries are trying to ease the lockdown, and there might be a likelihood of the second waves of infection as a result of their easing of lockdown. And continuous lockdown will also mean evil for the economy. So they will open the lockdown, but there is likelihood of second wave of infection. So they need to, all the stakeholders already shown in those slides need to prepare for the second lockdown, so that they will know the number of days they have to stay indoor and what else they can do. So the people will take the ownership of the lockdown, not that the government will be compelling them to be indoor.
Just a quick one. The app that you're trying to build, you're targeting institutions. You're using that information to get to the public. My own question is that, and you want to show the data. Do you have capabilities in terms of data mining and data extrapolation and projections within your team? Yeah.
No, I still have to do some collaboration with other guys. I only have the capability in the issue of the modeling, developing the modeling, the simulation model.
Awesome. Thank you so much, Victor. And thank you all teams for presenting such amazing problem statements and solutions. We really hope you're looking forward to the prize presentations to find out how our judges decide. So for now, I will ask you guys to please slowly trickle out of the Zoom call, and we will send communications on when to expect the prize presentation Zoom link to be sent to you guys, and what time that prize presentation session is for all of you. Thank you so much, and see you later today.